Hi everyone! Welcome to a new series of fun and learning here in Teacher Vibal now in its Season 2. I am Teacher Princess, your study buddy here in this informative and insightful Health Friday. In the current situation that we have, not just here in the Philippines but in the whole world, it's better to be safe than sorry about the things we consume for our own health. Health commodities must be carefully selected and checked to avoid compromising one's health and well-being, especially since nowadays. This should be our priority. For today's session, we will talk about health information, products, and services. Are you ready for informative health session? In learning more about health information, products, and services, we will answer these questions. First, what are the guidelines and criteria in selection and evaluation of health information, products, and services? Second, what are the categories of healthcare professionals and the services they provide? And lastly, what are some facilities that are involved in providing health services? Before we proceed to the lesson, let us get to know these important terms that can help you better understand this lesson: information, commodity, evaluation, professionals, complementary medicine. Information. These are knowledge that you get about someone or something. These are also facts or details about a subject. Commodity. A commodity is something useful or with a value that is sold or bought. Evaluation. Evaluation means to assess the value or condition of someone or something in a careful or thoughtful way. Professionals. It means relating to a job that requires special education, training, or skills. Complementary medicine. It is any of the practices of alternative medicine accepted and utilized by mainstream medical practitioners. One of the example is acupuncture. Health products are any commodities that directly impacts one's health. These are products that may be sold, purchased, and consumed to aid in bringing complete state of health. When we buy health commodities, we must keep in mind that it is part of our responsibility to evaluate health information, health products, and health services before acquiring them. Now, what are some guidelines that we can follow and some criteria that we may use to evaluate health commodities? First, do a background check. Make sure your resources are either licensed professional of the specific field, articles from an established publishing group, or the products will come from a respected brand or label. The second is to counter check. You can always ask for second opinions and check for consistency with statements of other health professionals. You may also check some surveys for satisfaction ratings. Third, compare and contrast. Identify some similarities and differences of other information, products, and services to highlight the most practical and reasonable option. The fourth is follow instructions. Since most commodities can only assure utmost quality if a specific set of procedure is followed, make sure to observe these instructions. Even the best products and services may wind up useless if you take matters into your own hands. Fifth, tailor fit. Make sure to choose the proper information, product, and service that will fit to your own needs. What worked best for your parents, siblings, friends, or teachers does not assure that it will have the same effect on you. A health emergency can happen anytime or anywhere. We have health professionals for a specific health need or illness, and there are facilities that specializes in particular conditions. Knowing where to go and whom to seek help from can be life-saving and can even save us time, money, and effort. Health professionals are individuals who garner specialized education, training, and necessary license to provide appropriate preventive or optimized health services. Here are some of the examples of categories of health professionals according to International Standard Classifications of Occupations or ISCO, a worldwide organization that classifies professional occupation. Specialist and generalist medical doctors. These are individuals who have successfully accomplished their postgraduate degree in the medical field, and their main responsibilities are diagnosis, treatment, and prevention of threats to the well being of patients. Nursing professionals. These includes our nurses that are professionals who have completed specialized training in their field and provide treatment and care to patients. Midwifery professionals. These are professionals that are trained to provide care for pregnant women and newborn babies. They provide support, assess risks, and perform needed practice in aid of the mother and child. Traditional and complementary medicine professionals. These are competent professionals with extensive knowledge of traditional and complementary medicine. Their treatment procedures are usually culture based and depend on certain belief system. Dentists. These are professionals that are responsible for diagnosis, treatment, and prevention of threats to oral health. Pharmacists. They are professionals that have the main responsibility to monitor and dispense medicine, and they may provide additional procedural instructions beyond what is specified on the prescription. Physiotherapists. These are professionals that are mainly concerned with the motor functions of the patient. They provide therapy to rehabilitate and maximize the necessary movements needed by the patient. Dietitians and nutritionists. They are the professionals that assess the current health status of their patient and note the excess or lack of certain nutrients in their systems. They devise meal plans to make sure that the patients get the optimum amount of nutrients that their body need on a daily basis to improve their health. Audiologists and speech therapists. Audiologists and speech therapists require higher form of training. Their primary concerns involve the auditory and speech functions of the patient, which are usually interrelated. Optometrists and ophthalmic opticians. These are professionals who ensure the safety, health, and functionality of one's vision. They provide advice on how to implement measures to ensure proper care on our eyes. Knowing our professionals is very vital to our own health and to cater to specialized needs that can be addressed through specific needs. Now, what are some facilities that are involved in providing these health services? Let's check them out. Hospitals. These are specialized institutions or establishments that cater to the health concerns of patients from emergency cases to chronic illnesses to therapy sessions. The health professionals discussed earlier mostly work in hospital. Clinics. These are establishments that are smaller than hospitals. They also cater to a variety of health concerns and have different health professionals at any given time. There are also specialized types of clinics that attend only to a certain set of health concerns. Examples are dental clinics, eye clinics, and the like. Local healthcare centers. In the Philippines, each municipality or barangay has a health center. This is usually a local health facility where residents of the municipality are provided free or subsidized healthcare. Psychiatric facilities. While most of the said facilities are mostly concerned with physical health, there are psychiatric facilities that specialize in the mental and emotional health of people. Patients who undergo psychiatric help may be voluntarily seeking professional assistance or are required to undergo such.
Nursing homes. These are facilities that cater to specific patients, usually elderly individuals who can no longer care for themselves and have no one to care for them at home. In facilities like this, the elderly are made to interact with one another, are provided with healthy meals, and are assisted in their daily routines.
It is always important to be aware of who and where to go for help so as not to waste our precious time, money, effort, and resources. Now, let's go back to our questions earlier and answer them.
What are the guidelines and criteria in the selection and evaluation of health information, products, and services?
Do a background check, counter check, compare and contrast, follow instructions, tailor fit.
What are the categories of healthcare professionals and the services they provide?
According to International Standard Classification of Occupations, health professionals are categorized as follows.
Specialist and generalist medical doctors, nursing professionals, midwifery professionals, traditional and complementary medicine professionals, dentists, pharmacists, physiotherapists, dietitian and nutritionist, audiologists and speech therapists, optometrists and ophthalmic opticians. What are some facilities that are involved in providing health services?
We have hospitals, clinics, local healthcare centers, psychiatric facilities, and nursing homes. What a fun and informative session we had, kids! You are really fantastic. I hope you learned a lot about health information, products, and services. Don't forget to click thumbs up and share this video to help students like you in learning more about health. And also make sure to subscribe to our YouTube channel at Vibal TV. Once again, this is Teacher Princess and see you on our next informative and insightful Health Friday.